According to the Oral Cancer Foundation, there are about 48,250 cases of oral cancer per year in the United States. With this, there is about 9,575 deaths per year regarding oral cancer. The question is, are these numbers on the rise or are they decreasing? The goal is to urge citizens to get regular checkups at their physicians and at a dental office. Most cases, when they are found, are diagnosed during its late stages. Once oral cancer has reached the late stages, it gets very complicated to treat, if it can be treated at all. The first step is to recognize how to diagnose oral cancer. The only ways to get an affirmative answer is by a physical examination and a biopsy. It is said that 75% of oral cancer is related to alcohol or tobacco use. Tobacco is the single largest preventable cause of death in the United States. According to the Center for Disease Control, nearly 40 million United States adults will smoke cigarettes. With alcohol use, there is about 88,000 deaths per year in the United States. Not only do patients need to be aware of the oral cancer statistics, but they need to stay away from these tobacco and alcohol statistics as well. I urge patients to be alert at the different signs and symptoms of oral cancer so they can also catch oral cancer early. When entering a doctor's or dental office, the protocol is to be examined for oral cancer at least once a year. By having two doctors examine a patient, this gives a better chance to detect oral cancer at its earliest stages. The most common sites for oral cancer to occur are the tongue, tonsils, oropharynx, gums, and the floor of the mouth. Some of the instruments that are used to diagnose oral cancer are tongue blade, light source, 2x2 gauze, and mirrors. Now, in dental and doctors' offices, they have new technology like a Velscope. This is specifically made to detect oral cancer. Oral cancer screenings can take all of 5 minutes, so why not go into an office to spend 5 minutes to get screened instead of being part of the statistic? I also urge people to educate themselves on the signs and symptoms so they are aware of taking care of themselves and preventing oral cancer. It is best if you can catch the early signs of oral cancer, which can be mistaken for a toothache or a cold. Some signs that patients need to be aware of are difficulty chewing, numbness of the tongue, voice changes, jaw swelling, or even loosening of the teeth. Patients need to get screened to lower this statistic. According to the Oral Cancer Foundation, a person dies from oral cancer every hour of every day. Let's not be a part of the statistics and get examined by 2 doctors every year.